Thank you for joining me today for our fourth training video called How Can I Make a Difference Part 1. I'm Dr. Carrie Finley, and I'm a senior research scientist at the Center for Health and Safety Culture at Montana State University. Before working at the Center for Health and Safety Culture, I managed a behavioral health clinic serving individuals with mental health and substance use disorders. And during that time, I experienced firsthand the impacts stigma has on addressing these issues. This video, called How Can I Make a Difference Part 1, is the fourth in a series of 6 training videos. Other videos in this series include What is Stigma? How does stigma impact us? Where does stigma come from? How can I make a difference? Part 1 and 2, and where do we go from here? Each video in the series is approximately 7 to 10 minutes long, and we encourage you to review and discuss all 6 videos. There's a handout that goes along with each video, and we encourage you to take notes and fill in the sections on the handout. Please feel free to pause the video or repeat sections as needed. In today's training video, we're going to talk about labeling theory, and we will talk about how we can use our understanding of labeling theory to make changes in our own language choices. We'll also focus on the language we use and how those language choices can either contribute to stigma or reduce it. But before we do that, let's review what we've learned so far in training videos 1, 2, and 3. We started this video series focused on defining stigma as a strong feeling of disapproval that most people in society have about something. We talked about how stigma can generate negative attitudes about people with a condition and how these negative attitudes can lead to discriminatory practices. We further defined stigma as a social process. That is, something that a group of people, often those in power, create towards other people. It is a collection of attitudes, beliefs, behaviors, and structures that interact at different levels of society. At the individual level, in groups, in organizations, and in various public systems. Stigma is complex, and it can appear in several different ways. We explored 4 kinds of stigma: public stigma, self-stigma, courtesy stigma, and structural stigma. And we talked about the negative consequences that stigma can result in, like barriers to new relationships, lowered self-esteem, feelings of shame and guilt, and a reduced sense of hope, just to name a few. We also started to dive into exploring why certain conditions get stigmatized and others don't. And we looked at a variety of different factors that researchers have identified as contributors to stigma. Now, we're going to explore a theory called labeling theory and talk about how we can use our understanding of labeling theory to make changes in our own language. Labeling theory is one theory that has been developed to explain the phenomena of stigma. And while I won't go into the details about the theoretical foundation that underpins stigma, I think it's helpful to highlight some of the big ideas. Labeling theory suggests that a person's self-identity and behavior may be determined or influenced by the terms that are used to describe or classify them. For example, if I use the label bad kid to describe a child, through that classification, the child starts to identify and behave in ways that reflect that label. The child who has been labeled as bad kid is stigmatized through rejection, isolation, and possibly discrimination, which can cause the child to eventually adopt a self-concept, a deviant self-concept, and to adopt behaviors that align with that lowered expectation. Instead of the label bad kid, we could use other stigmatized language to describe people, like addict, or any other language that makes a person an object. Even well-intentioned labels like survivor might unintentionally create stigma. So how do we take what we know about labeling theory and apply it to making differences to reduce stigma? Let's explore labels and our own language. We get to choose the language that we use. We get to choose how we talk about other people. SAMHSA's Center for the Application of Prevention Technologies developed a short and simple document to illustrate the importance of choosing our words and how our language choices can reduce stigma. I want to highlight a few of these important examples they provided in their document to really illustrate the power of language and how the words we choose can have unintentional consequences sometimes. Labels are used to reference a group. So let me give you one example of how labels can perpetuate stigma. For example, the statement, Angie is bipolar, suggests that Angie and bipolar are one and the same. However, if we say Angie has a bipolar disorder, that signals that the condition, bipolar, is separate from the person. It also conveys that bipolar is a condition that could happen to anyone. By putting the person first, Angie first, it conveys that we acknowledge that this person has a condition, but that the person is not the condition. What would it be like to say, I talked with a bipolar today? It would put Angie in a group and begin to create that social divide between Angie and everyone else. It would make Angie the same as her illness. Another example illustrating the caution that we need to take with labels includes how we talk about a person with a substance use disorder. Saying a person with a substance use disorder puts the person first and suggests that a person has a problem that can be addressed. In contrast, calling someone a drug addict implies that the person is the problem. Words are powerful. This quote, protest any labels that turn people into things. Words are important. If you want to care for something, you call it a flower. If you want to kill something, you call it a weed. I think this is a really important quote because it illustrates the importance of choosing person-first language. Avoid describing people as the problem or their condition. A person has a condition instead of the person is the condition. Just this simple shift in our language to focus on the person first conveys respect. So let's do a quick activity to explore our own language. I've identified some common words or phrases and started to think about better ways to describe the situation in a way that more accurately describes people with a condition as opposed to making the person and the condition the same. As we go through these examples, think about other examples that you hear in your organization. For example, instead of using the term addict, we could say a person has a substance use disorder. Instead of saying a schizophrenic, we could say a person that has schizophrenia. Instead of saying a dirty UA, we could more accurately say a positive urine analysis. Or instead of saying a person is autistic, we could say the person has autism. Before concluding this video, please take some time to think about the reflection questions that are listed on your handout that accompanies this video. What language choices, personally or professionally, could you use that would be more inclusive and less stigmatizing? How do you believe stigma can be changed or impacted simply by language choices? How do you believe that change will occur? We encourage you to take notes on your handout and feel free to pause the video or repeat sections as needed. If you're watching this video with others, we encourage you to engage in a discussion about these reflective questions. I also want to mention that at the end of this training video is a bibliography, which lists a variety of different publications that have been used to create this learning video. I encourage you to review the bibliography for additional reading opportunities. This fourth training video in the Stigma training series talked about labeling theory and explored how we can take what we know about labeling theory and apply it. We explored language and labels, and I encourage you to think about the language that you're using, whether that's at home or at work, and to think about whether the language that you're using might perpetuate stigma or reduce it. Remember, we interact with people, and the language we use to describe people matters. Please join us for our next training video, How Can I Make a Difference Part 2. In this video, we're going to explore other actions that we can take to reduce stigma. Thank you for joining me today.